Welcome to the deep dive. Today, we're really zeroing in on something that, well, it's a challenge for a lot of adults, ADHD.
Hmm.
And we're moving past maybe the childhood ideas people have. For adults, it's often about, navigating daily organization, time management, keeping focus.
Exactly. And look, while medication is definitely one route, we know a lot of you are searching for practical, hands-on strategies, things you can
Okay.
actually weave into your life to feel more in control, maybe without relying only on meds.
And then that's exactly why we're doing this deep dive. We've gone through the research, tried to pull out the really useful
Yeah,
bits,
the actionable stuff.
insights that can hopefully make a real difference without, burying you in information.
Hmm.
So, what non-medication strategies are we actually digging into today?
Okay, so we've got some really promising areas. First up, the power of exercise. Maybe surprising for some,
Hmm.
how it impacts focus, not just for kids, but adults too. Then we'll look at a specific kind of group therapy that's getting results, DBT-based treatment.
Yeah.
We'll also touch on ADHD coaching, what that is, what it might offer, and then, yeah, wrap up with some concrete everyday self-help tips you can try.
Okay, sounds good. Let's jump right into exercise then. We all kind of know it's good for us generally, but how does it specifically help with those focus challenges linked to ADHD?
Well, what's really interesting here is how even like short amounts of activity can act almost like a mental reset.
Hmm.
Research, especially with younger kids, shows just 30 minutes a day can lead to noticeable improvements. Better focus, even a better mood. Think of it like a natural attention booster.
30 minutes, that's pretty significant impact for not a huge time commitment. And this wasn't just for, say, the super hyperactive kids.
No, exactly.
Yeah.
They saw benefits both for kids struggling more with impulsivity and hyperactivity and for those who were primarily inattentive.
Okay.
But, the bigger picture here is exercise isn't just for ADHD. It helps everyone's brain function better. Sure. Plus, it's huge for reducing stress, anxiety, things that mess with focus for anyone, really. And, of course, building good health habits long term.
Right. Kind of a win-win there. So when we say exercise, what are we talking about? Does it have to be like a formal gym workout? Because I know that can feel like just another thing to manage.
That's a really important point.
Hmm.
The key thing, honestly, find activities that get your heart rate up, but that you actually enjoy.
Ah.
It could be anything, a brisk walk, riding your bike, dancing, swimming, even just, playing tag if you've got kids. If it's fun, you're way more likely to stick with it.
That makes total sense. If you dread doing it, it's not going to happen regularly.
Exactly.
What about people who maybe aren't into team sports? Are there good alternatives?
Oh, absolutely. Lot. If that competitive team thing isn't your vibe, think about swimming, track, maybe fencing or martial arts.
Hmm.
And remember, it doesn't always have to be a dedicated exercise session. Just weaving more movement into your day counts. Family bike ride, quick walk on your lunch break, taking the stairs.
Yeah.
It all adds up.
Good point. Okay, let's switch gears a bit. Let's talk about something maybe newer for some listeners. This DBT-based group treatment for adults with ADHD. Now, DBT, Dialectical Behavior Therapy. I often hear about that for emotional regulation. How does it fit with ADHD?
Well, what's so insightful, I think, is recognizing that adult ADHD often involves more than just focus issues, right?
Sure.
Many adults really struggle with organization, time management, handling emotions effectively, even sometimes feelings of low self-worth. DBT offers this framework. It focuses on both accepting where you are and making positive changes. It seems to really address those broader challenges.
And there's actual research backing this up for adults with ADHD specifically.
Yes, there was a significant study. It compared a 14-week program, they called it DBT-based group therapy, or DBT against treatment as usual. And this DBT program had a few core parts: helping people understand their ADHD better, psychoeducation, basically, teaching acceptance strategies, using mindfulness practices, being more present, and also something called functional behavioral analysis.
Functional behavioral analysis. What's that in simple terms?
It's essentially like figuring out the why behind certain difficulties, what triggers certain behaviors or challenges, so you can develop better ways to respond.
Got it. Okay. And how did this DBT group compare to the usual treatment?
The results were really encouraging, actually. The DBT group showed significant improvements in what's called executive dysfunction.
So the planning, organizing, task management stuff.
Exactly that. They also reported fewer core ADHD symptoms, less inattention, impulsivity, and importantly, a noticeable improvement in their overall quality of life.
Wow.
And what's really promising, these benefits were still there 6 months after the treatment ended.
That lasting effect is huge. What about the emotional regulation piece you mentioned earlier? Did that improve right away?
That's interesting. They didn't see a huge difference right after the 14 weeks compared to the other group.
Right.
But at the 6-month follow-up, the DBT group had continued to improve in that area.
Huh. So maybe those skills take a bit longer to really solidify.
It suggests that, yeah, like you keep practicing a bit and building on them. Oh, and the DBT group also showed a significant drop in depressive symptoms.
That's another big benefit. So what does one of these sessions actually look like? If someone joined this group, what's the experience?
Okay, so it's typically weekly 2-hour group sessions, usually about 7 to 9 people, plus 2 therapists.
Mm-hmm.
A session might kick off with maybe a short mindfulness exercise just to get everyone grounded. Then they'd likely review homework from the last week, practicing the skills.
Okay.
The second half is usually introducing a new skill, could be related to managing impulses, maybe improving self-esteem, something like that.
Mm,
And then they get new homework to practice that skill.
right.
And a really key part, I think, is after each group session, there's a short, like 15, 20-minute individual coaching bit. Yeah, just to help tailor what they learned to their specific goals and challenges.
That individual check-in sounds really valuable for making it stick personally. And what did treatment as usual look like in this study for comparison?
Treatment as usual was mostly individual appointments. Seeing a psychiatrist or psychologist mainly focused on giving info about ADHD and managing medication.
Okay.
On average, those folks had maybe 4 or 5 appointments over the whole 14 weeks.
So it really highlights how the structured group approach with DBT gives a solid non-medication option for adults to really tackle symptoms and, well, improve things.
Exactly. The study concluded it's not just effective, but also feasible, something that could realistically be offered in mental health services.
All right, let's move to another area getting buzz, ADHD coaching. What exactly is an ADHD coach doing?
Think of a coach almost like a guide, someone who helps you manage the day-to-day ADHD challenges, but also helps you leverage your strengths.
Yeah.
They focus on teaching practical skills, things like study habits, getting organized, planning, time management. Also self-advocacy, which is huge, managing impulses, social skills, problem solving, that kind of stuff.
So it sounds more like building strategies and offering support rather than, say, treating the underlying ADHD itself.
That's a really crucial distinction, yeah.
Yeah.
Coaching is a supportive tool. It's not meant to replace medical treatment or therapy.
Right.
It works alongside those things, helping you put effective strategies into action in your actual life.
And is there good evidence showing it works? Does it make a difference?
Well, the research here is still kind of evolving. A lot of the studies have been smaller, maybe use different coaching methods. But there was a review that looked at 19 studies. And in most of them, 17 actually, they reported positive changes in ADHD symptoms from coaching. Some also showed improvements in just general well-being and satisfaction.
Okay, so while the formal research is still growing, there are definitely positive signals. And anecdotally, a lot of people find it helpful.
Exactly. Many people find it really helps with issues that maybe aren't fully addressed by other interventions. Specific practical life stuff.
What kind of specific benefits might someone get from working with an ADHD coach?
Well, a big one is often gaining a much deeper understanding of how ADHD affects them personally.
Yeah.
It can provide really valuable support in setting goals, personal, professional, and actually working towards them. It can boost self-advocacy skills so you can communicate your needs better, and even help strengthen relationships just through better understanding and communication.
Who might be a good candidate for thinking about coaching? When would it be most useful?
Coaching could be really beneficial if you're looking for that more personalized understanding of your ADHD, or if you feel you need extra support in specific areas, maybe work, school, relationships.
Okay.
Also, if you have particular goals you're stuck on. And yeah, it can be helpful for people who aren't taking medication or just want that extra layer of practical support alongside whatever else they're doing.
Now, I have heard that ADHD coaching isn't like a licensed or regulated profession in the same way therapy is. What should someone look out for when searching for a coach?
Yeah, that's a really important point to make. Because there isn't that formal licensing, you really need to do your homework.
Right.
Look for someone who clearly has a solid understanding of ADHD. You want someone empathetic, a good listener. Clear communication is key. They should be transparent about their fees, their approach.
Your sense?
And be a bit cautious if someone makes claims like they can cure ADHD or if they start giving medical advice that's definitely stepping outside the role of a coach. Maybe ask for testimonials or references if you can.
That's definitely useful advice. Okay, finally, let's dive into some general self-help tips. Things adults with ADHD can start using, right away, day to day. Where's a good place to start with, say, organization and just tackling clutter?
A great starting point is breaking things down. Those huge, overwhelming tasks. Make them tiny, manageable steps, micro tasks almost. Using planners, reminders absolutely key. And digital tools with those automatic alerts. Lifesavers for many. Make lists. And try the 2-minute rule. If it takes less than 2 minutes, just do it now.
Ah, good one.
Setting up a simple filing system helps. Dealing with mail daily, don't let it pile up. And maybe even think about going paperless where you can. It can really cut down on the physical clutter.
And what about that constant struggle with managing time?
Yeah, time management. Facing procrastination head on is crucial. Practice getting better at estimating how long tasks actually take. We often underestimate badly.
Guilty.
Yeah. Be aware of that tendency to hyper-focus on one interesting thing and totally lose track of other stuff.
Yeah.
And learn to say no sometimes, or at least let me check my schedule first before committing. Protect your time.
Very important. Money management can also be a real source of stress. Any tips there?
Absolutely. First step. Figure out where your money is actually going. Track your expenses for a bit. Then you can build a realistic budget. Use online banking, automatic bill pay, easily checking balance is super helpful. Set up bill reminders too. Lots of budgeting apps out there now that can help.
Right.
And for impulse spending, maybe try using cash for certain things. Limit your credit cards. Always make a shopping list.
Yeah.
And try to avoid those places or situations where, you tend to make impulse buys.
Okay, good practical stuff. What about focus at work? That can be a minefield.
For sure. Organizing your actual workspace helps. Set aside even just 5 minutes a day to tidy up. Visual aids, color coding, lists can be great. Prioritize tasks. Set deadlines for yourself.
What about minimizing distractions? That's a tough in open offices.
Yeah, tough but doable sometimes. If possible, communicate your need for focus time to colleagues. Adjust your workspace, maybe face a wall, reduce clutter on your desk, use a do not disturb sign if appropriate. Use voicemail. Noise-canceling headphones can be a game changer. In meetings, try to get key info in writing. And maybe repeat directions back just to make sure you caught them correctly. And don't forget to move. Take short breaks. Walk around if you feel restless.
Finally, managing stress and mood swings. That's often part of the picture, too.
Huge. Establishing consistent, healthy routines is really foundational here.
Like sleep and eating.
Exactly. Regular meal times, prioritizing enough sleep, making exercise regular, try to avoid caffeine late in the day. Exercise is great, but maybe not right before bed. Create a relaxing bedtime routine. Stick to a consistent sleep schedule as much as possible, even weekends.
Okay.
For eating, regular small meals or snacks can help stabilize energy. Maybe limit sugar, focus on protein. And finally, explore relaxation techniques. Mindfulness meditation, yoga, tai chi, these have actually been shown to help improve attention and impulse control over time.
This has been incredibly helpful, really a comprehensive look at so many practical strategies. It just highlights, I think, that managing adult ADHD is, well, it's a journey, right? Lots of different paths.
It really is. And it takes practice, definitely patience with yourself, and just being willing to try things out, see what sticks for you.
Yeah.
But like we've talked about, there are a lot of effective tools and approaches beyond just medication that can make a really significant positive difference.
And just to recap those key takeaways again, we talked about the real impact of exercise on focus.
For kids and adults.
The promise of that DBT-based group therapy for adults.
Yeah, really encouraging results there.
The supportive role ADHD coaching can play.
As a practical guide.
And just a whole bunch of actionable self-help tips for everyday life organization, time, money, work, stress.
And often the most powerful approach is mixing and matching, right? Integrating these different things, maybe some professional support, maybe some self-help techniques to build a toolkit that really works for you.
So as you listening, take a moment to think about all this. Maybe consider what resonated most. What's just one small, doable step you could take, maybe even today, to feel just a little bit more in control, a little less overwhelmed?